Okay. And again, glad to have everyone here. So we're just going to keep going with introductions. Next we have Tara Rick. Go ahead, Tara.
Hi, everyone. My name is Tara. I'm a physician assistant at the University of Minnesota, and I've been an oncology PA for the past 16 years, but just transitioned over to survivorship in the past year. So I'm here because I'm excited about the community and excited about learning from each other and seeing what everybody else is doing. So thank you for organizing this.
Absolutely, Tara, and thanks for taking the time to join us today. Next, we have Heather Kurz. Go ahead, Heather.
So I'm Heather Kurz. I'm an oncology nurse practitioner. I just recently took a new job with Kaiser in San Francisco, I was more general oncology. So now I'm focusing more on breast, which obviously has a lot more survivors. So I'm here to learn.
Fantastic, and that's our aim too, is all to learn from each other. Glad to have you, and what a representation from Kaiser. All right, and next we have Heather, I can't see your full name, Heather. Heather, is it MC? Go ahead and unmute if you can. Heather B. Oh, let me see if I can. We'll come back to, excuse me, Elizabeth B. I think I was still saying Heather from before. That's my fault. Thank you.
Hi, I'm Elizabeth McGrath. I am a nurse practitioner at Dartmouth Cancer Center up in Lebanon, New Hampshire, here with my esteemed colleague, Heather Wishart. And we are a robust interdisciplinary committee steering some of the survivorship activities. From a survivorship standpoint, we've really been so diligent about trying to get survivor care plans across the board. That's where we've spent the majority of our time, and now with COC accreditation changing, it's an about face, and we're all trying to struggle and figure that out. So it's really lovely that you've brought everyone together so we can learn from each other.
Absolutely, and thanks for joining us. And I knew there was a Heather somewhere in that connection here with Elizabeth, so thanks for that. All right, and next we have Jill Vanatosky. Jill, go ahead. Glad to see you.
Thank you. I'm Jill Vanatosky. I'm a primary care physician with Northeast Medical Group in Westbrook on the Connecticut shoreline, which is a division of Yale New Haven Health. So my patients predominantly get admitted to Yale Hospital. I learned initially about cancer survivorship when I had a young woman who had been a prior ALL patient and had a very rigorous program from where she had her transplant in Boston, but realize now how many needs my current patients who develop cancer as adults, which is my primary population, need, and how many needs they have and need to be addressed. So I'm like a little overwhelmed by the number of people who are working on this, and I feel like sometimes I'm kind of like the lone person trying to make sure I'm addressing all the needs the patient has. So I'm pretty excited to learn from the multidisciplinary perspectives that you all have. My other hat actually is that I'm the medical director for a small private college in New Haven called the University of New Haven. So, and we do have a few students who ultimately develop a cancer diagnosis, but we hope they're few and far between for sure.
Absolutely, and so happy to have you here, Jill, too. Appreciate that. Next, we have, it looks like V.H. Amanda Worth. Can't see the full name. Forgive me here.
It's okay. I'm at the VA in Manchester, New Hampshire, and it's Doris Worthen, and I'm the LPN for oncology. And Marilyn Bruderer is the NP, but she actually has tumor board today, so she wasn't able to attend. But so I'm trying to get as much information as I can because we're just starting the program here.
Great. Well, welcome, Doris, and we're glad you could be here nonetheless. All right, and then we have Carrie Ann Go ahead, Carrie Ann.
Hi, I am Carrie Ann Sleep. I am a licensed professional clinical counselor at Providence St. John's in Santa Monica. I work out of their hematology oncology clinic as the oncology behavioral health specialist. I'm part of the collaborative care program, and this is the first time that we are doing oncology collaborative care. So I'm just here to learn and to just get some more information about all the different approaches that can be taken with cancer patients. Thanks.
Thanks so much, Carrie Ann. Appreciate that, and glad to see your representation here too. And next I have Michelle Kirshner. Go ahead, Michelle.
Okay, hello. I'm a nurse practitioner at the University of Cincinnati. I'm the Director of Program Development for Survivorship and Supportive Services. I've been working in the survivorship space for 6 years with background in interventional pulmonology and interventional cardiology and internal medicine prior. And I serve as a COC director, and then I'm in the consultative survivorship clinic. So I see all cancer types, breast, prostate, head and neck, GI. I have a neuro-oncology clinic, survivorship clinic that I run for malignant and benign brain tumors. And I also serve in a cognitive clinic that I develop for cancer patients within neurology. And yeah, that's about it. And I'm very excited being here and hearing about what other people are doing and serving as a resource.
Michelle, we're so happy to have you, and like hearing all the hats you wear too. Okay. Next we have Simone. Simone, it looks like you're coming from the OR.
Hi, sorry I'm a little bit late. Yeah, we had some staffing issues, but my name's Simone. I am an old nurse. I'm a new nurse practitioner. I work with endocrine surgery. I actually spent a half a day, was fortunate enough to spend a half a day with Javin and his staff in the survivorship clinic. We do refer out a lot to him, so I'm just here trying to learn as much as I can.
Simone, so happy that you could join us today. Thanks for that. Next we have Paige Cow. Go ahead, Paige.
Hi, my name is Paige. I am a nurse and the survivorship program coordinator at Wilmot here in Rochester, New York. So I'm just here to learn a little bit more about everyone's programs as we kind of hope to grow our program as well as our consultative survivorship clinic.
Great. Thanks, Paige. Appreciate having you here. Let me see here. It's repeating some of the people. It changed the order on me. Bear with me just a sec. Looks like next we have Jocelyn Bushart. Go ahead, Jocelyn.
Hi, my name is Jocelyn Busher. I'm from the Wilmot Cancer Institute. I work with Paige. I'm the nurse practitioner of the consultative survivorship clinic here, and just here to kind of expand and continue to grow on survivorship.
Great. Thanks so much, Jocelyn. Glad to see you here too. Let's see, I want to make sure I'm not forgetting anybody. Shifting people around on me. Okay, and next I see Stephanie Crappie. Go ahead, Stephanie.
Hi, my name's Stephanie Cropey, and I am a nurse and cancer program administrator at Madigan Army Medical Center. And I'm really excited to see how everyone is getting after survivorship.
Great, good to have you, Stephanie. Thanks for joining us. Appreciate that. Next I see Tessa Flores. Go ahead.
Hey there, everyone. Dr. Tessa Flores here at Roswell Park in Buffalo, New York. I'm the medical director of cancer survivorship and screening. We've had our program from 2017, pretty comprehensive, just here to see what everyone else is doing. And Claire Wise is my PA. She's also on. Glad to be here.
Well, we're happy to have you both here with us. Thank you so much. All right, and I see Robin Zwirling. Go ahead, Robin.
Hi, I am a family medicine doctor at Kaiser Permanente in Oakland, California, and I work at the breast clinic there, and we're starting up a new survivorship program, so I'm excited to learn from all of you.
Fantastic. Thanks, Robin. Appreciate that. And again, more Kaiser Permanente representation. I like it. Renee Yankee or Yank?
Hi, yeah, it's Yankee.
Yankee, sorry.
So I'm the oncology clinical nurse specialist for Kaiser Permanente of Washington. So I work with all of the clinics and the entire program. So we're working on trying to build our survivorship program and get it steered in the right direction. So I'm happy to be here and learn more, like everybody else.
Fantastic. Thanks so much, Renee, for joining us too. Next, I see Amina. Go ahead, Amina. Amina, I'll give you a second if you have a chance to unmute and if you're not tied up. All right, well, we'll come back to Amina if she's available in a moment. I see Erica Udall.
Hi, I'm Erica. I'm a nurse practitioner in the breast surgery department at Kaiser in Oakland as well. I work with Robin, and we are starting up a survivorship program as well.
Great, thank you, Erica. Thanks for joining us too today. I see Claire Wise. Go ahead, Claire.
Hello, everyone. My name is Claire. I'm a physician assistant with Roswell Park in Buffalo, New York, with a background in primary care. I've been in the survivorship clinic at Roswell since November of 2020.
Great to see you here too, Claire. Thanks so much for joining us. Let's see if I missed anyone else before I get to...
Jevin, Michael Stofko.
Oh, yep. So Michael is here with us too in our team. Go ahead, Michael.
Hi, everyone. I'm Mike. I'm a student from Quinnipiac PT. I'm working with Scott, who will introduce himself later. And I'm happy to be here.
There might have been some feedback there. Sorry about that. I think we're in close proximity, so forgive that. Everyone heard that Mike is from Quinnipiac University. He's a physical therapy student with our survivorship clinic. Okay, and I think I got everyone that isn't directly from our team. If there's anyone else that hasn't had a chance to speak, feel free to unmute and introduce yourself.
Seems like we got everybody.
I think we got everyone, yep. So I already introduced myself. Tara, why don't you go ahead and let everyone know who you are?
Yeah, thanks, Jevin. I'm Tara Samt. I'm a breast medical oncologist here at Yale. I've been the director of the survivorship clinic since 2010. And this being a part of this team has really changed my life. This is our third national echo. And it's just like so exciting to see all of you here. And I think we do this to create the community as much as you are hoping for that same thing. So we want to learn from you as well, and just want to give you a warm welcome.
Thanks, Tara. I really appreciate that and totally agree. It's about fostering this community and learning everything we can from each other here. Okay, and next, Angela, why don't you go ahead and introduce yourself to the group?
Hi, everybody. Thank you so much for joining us today. My name is Angela Kerala, and I am the clinical social worker in our cancer survivorship clinic. I've been here going on 9 years now, working within this clinic. And I also work in the Yale, the Smilo Breast Center with Jevin and Dr. Stamp. So thank you so much for joining us today.
Thanks, Angela. Appreciate that. And last but certainly not least here, we have Scott, a physical therapist. Go ahead, Scott. Let everyone know who you are.
Hey, everybody. Hope you're all doing well. I'm Scott. I'm the physical therapist part of the survivorship clinic. I'm the last remaining member, the original member when we opened the survivorship clinic at Yale Cancer Center back in 2006. And so I've definitely seen a lot of growth over the years. We've kind of changed our model over the years, and get to work with this amazing team now, which is really great. And Jevin, if I can, I'll give a shout out to our longtime dietitian, who's not with us right now. She would be joining us for future sessions. My longtime work wife from Survivorship Clinic, Maura Harrigan. She's board certified dietitian in oncology, and so she will be joining us in future sessions to talk about the importance of nutrition and the role of nutrition in survivorship.
You read my mind, Scott, there. You had me covered. And it's what we do as a team. We cover each other. We have each other's back. So thanks, Scott. Appreciate that. And great shout out to Maura too. You'll see Maura in future sessions. She couldn't be with us here today though. I saw our program coordinator, Kiki, was able to jump on here too. Kiki, we'd love to hear from you and have you introduce yourself. I'm not sure if she's able to right now. Let me see here. Okay. Well, Kiki can chime in if she's able to later on, but I did also see someone else jumped on, John Joseph. John, if you're able to unmute yourself and introduce yourself to the group, we're starting with some introductions as people are coming in. All right, well, I'm not sure if John's available right now, but that's okay. Oh, John, looks like you unmuted yourself.
I did.
Great.
Joining late, I was in the middle of emergency patient meeting.
John, having a bit of a hard time hearing you. Was hoping to hear who you are and where you're coming from joining our echo today.
Oh yeah, John Byrne, social worker, Dartmouth-Hitchcock Medical Center, inpatient hematology oncology. And I apologize for joining late. I had an emergency family meeting.
John, that's no problem at all. Thank you for taking the time to join us. And no, it was perfect timing. Thank you.
Thank you.
All right, and I wasn't sure if Amina was available now. Amina, we tried coming to you before. Wasn't sure if you were busy or unavailable. If you're able to unmute and introduce yourself, that'd be great.
Jevin, just a time check. I think we should move on to the slides and she can put her stuff in the chat if she's available.
Absolutely, absolutely. So, and I'm gonna mute myself right here. There's an overhead announcement, sorry.
Why don't you share the slides and we can get started. We have about 10 minutes of talking here and then, I think about 10 minutes of discussion for those of you that can stay till the full hour.
Yes, so jumping into the slides here, I wanted to just give a chance for that to go past so it wasn't blaring overhead with a code or anything like that. But we're going to be talking today about Survivorship 101, and we want to welcome everyone. So this is just our introductory slide. We already introduced ourselves. And again, sort of went through this in the beginning. We're going to get into the didactic portion now with this brief presentation. And, we talked a little bit in the introductions what brought us here today. This was an icebreaker we had. I think for the sake of time, we're going to keep going past this, but something to keep in mind, and maybe we can circle back to this at the end. It's what.
Yeah, maybe they participants could put it in the chat. What is the #1 concern you see among cancer survivors, and maybe that would give us some good background while we're listening.
Sarah, that's a great idea. I love that. Definitely feel free to put it in the chat there. All right, so we're going to jump into Survivorship 101 and talk about some of the basics of survivorship. For these presentations moving forward, there are no financial disclosures. And so for the objectives for this presentation, we're going to talk about the definition of survivorship and who exactly are cancer survivors. We're going to talk about the phases of survivorship, sort of how we view people's perspectives as they're going through survivorship. Some of the concerns that cancer survivors face briefly, which we'll get into more in later sessions, and how we approach cancer survivorship through a multidisciplinary approach. So a cancer survivor, as defined by the National Cancer Institute, is anyone who has been diagnosed with cancer from the time of diagnosis throughout the remaining balance of his or her life. And this is coming from the Office of Cancer Survivorship through the NCI. And the focus of cancer survivorship, as many of you know, and that care is around people who have been diagnosed with cancer with their numerous concerns that they may have throughout the remaining balance of their life. And we think about cancer survivorship in different phases. So that acute phase we think of as the time when people are going through treatment and they're managing all of these treatment-related concerns, the weight of their diagnosis, will their treatment work, what are the financial concerns associated with it, how do I manage side effects, and so on. And oftentimes this is all consuming. And a lot of the later effects and concerns that they might have come after that phase. And that moves us into the extended phase of survivorship after they've completed active treatment. And that's when things like the emotional impact from their diagnosis and treatment, fear of cancer recurrence, managing late effects from treatment can come into play. And that's oftentimes when we as a survivorship clinic see people at this point in time. But then there's also the long-term phase of survivorship, and that's when you have these more long-term effects that even beyond some of the more immediate late effects right after they've completed treatment, continue to affect people. And that could be things like cardiotoxicity or a surgery that they might have had for their cancer treatment, any ongoing financial or job-related concerns. And these are things that are often considered to be permanent or maybe lifelong. You might hear those terms thrown around with that as well. And this was all coming from Dr. Mullen from the Seasons of Survival published in New England Journal of Medicine back in 1985, who first sort of brought up this concept. So it's a great way to look at cancer survivorship. And when we think about survivorship care, we think of 4 core tenets. We think of surveillance, which from the time when the Institute of Medicine published Lost in Transition, that's something that had been done well, and that is following up on managing cancer surveillance, looking for any signs or symptoms of recurrence. But we do that, obviously we think about that in cancer survivorship, as well as monitoring for other cancers through other cancer screenings. We think about identifying and managing late and long-term effects as well. And I want to highlight here that oftentimes during survivorship clinics, people don't always know what to be looking for. So identification of these is also very important to keep in mind. But we can also lend advice on ways to manage that. Health promotion is another way to manage survivorship care. And that can be things through keeping up with routine health maintenance with primary care and their other providers in their care team, keeping up with routine cancer screenings, as I mentioned before, vaccinations and so on, but also healthy lifestyle considerations, exercise and physical activity, nutrition, keeping in mind any limitations that people have in either of those regards, avoiding alcohol, avoiding smoking, or limiting alcohol, I should say, avoiding smoking, and things like that, as well as all part of promoting overall health and well-being. And then coordination of care, because it can be very tricky for people managing the different providers they have to see with their oncology team, other specialists they might have to see for maybe some of the late effects or other concerns that they might have. So really focusing on that as well is a core tenet of survivorship care and a key part of it. So there are a number of issues that cancer survivors face, and I go through some of these here, and we put it in the form of a Venn diagram, and you'll see why as we go along. With chemotherapy, you see a number of concerns: peripheral neuropathy, cardiotoxicity, cognitive issues, sexual dysfunction, and so on. With surgery, things like post-surgical pain or lymphedema, the cosmetic defects associated with it that people may have related to body image concerns, radiation, such as with that, lymphedema, radiation fibrosis. And then you have this other circle in this Venn diagram that comes in. It can be late effects from all 3 treatment modalities: fatigue, fear of recurrence, weight-related changes, and concerns about supplements and nutrition. You might look at that and say, wow, well, those are some of the topics that are going to be discussed in these sessions moving forward. And there's good reason. They're very common themes that we see in and you see some other concerns here listed as well. I'm not going to go through all of them, but as you can see, there needs to be care dedicated to cancer survivors for all these concerns that can occur. And here at our survivorship clinic, we take a multidisciplinary approach to this. And the benefit of that is really being able to manage these complex needs that cancer survivors have. So they can get the benefit of that one-stop shopping visit where they come in and see different providers, the medical oncology component, the social work component, the nutrition component, physical therapy component. And really this can extend beyond just those services. And we'll get more into that as we go along in our sessions here as well. But it's convenient, good for complex needs, and really can hone in on those late effects from treatment, as I mentioned. And Scott is our clinic historian, as we like to say. He's been around the longest with our clinic, and can talk to this even more in detail than I can, but there's a brief history on our clinic here as well. He'll talk about a little bit more of that in the next presentation, next session as well. So with that though, Scott, I mentioned you. I'm going to turn it over to you here.
Yeah, thank you. And I hope you weren't implying that I'm old, Jevin.
No,
being
certainly
around the longest here. No, so you're right. You know, when you brought up that Venn diagram of all the different, you know, physical concerns that our survivors might see or experience, that's really a big role of why you want a physical therapist or somebody, an occupational therapist, somebody in the rehabilitation field who has a background in oncology to hopefully be a part of your team when we're addressing concerns like radiation fibrosis and being able to have a healthy lifestyle to help prevent a recurrence of cancer. I saw so many people put in the chat their, you know, the concerns of the fear of recurrence, and through exercise and rehab, we can address that as well. So if we move forward, we can see, we move forward to the next slide, you know, again, there's a lot of things that not just physical therapists, but again, occupational therapists and even our speech therapy colleagues can kind of screen for if you're able to incorporate them into part of your program there. I will tell you just quickly that, you know, when it comes to physical therapy, both physical therapists and occupational therapists can be lymphedema certified. So if that's a priority for you to have that, that member on your team, I think that's fantastic. We now in physical therapy have board certification in oncology, just like our colleagues who are dietitians have board certification in oncology as well. So it's exciting to have that. But really, as we move forward to the next slide, you know, one of the big things is that we want to think about how can we help our patients move better, move more as they are going through treatment. So and into long-term survivorship.
My apologies, Scott. I think there was a slide here that I had in, and it seems to be missing in this presentation here, so forgive me for that.
That's okay. I'm sure we'll touch upon it in the next 5 episodes of our ECHO.
All right. Thanks, Scott, so much. Next, we have Angela. Go ahead, Angela.
Okay, hi again, everybody. I'm Angela, the clinical social worker on the team. And so when I meet with patients, I provide them with an opportunity to talk about how they're not only doing emotionally, but also socially and financially and spiritually and physically and sexually, because we know that when someone goes through cancer and treatment, it impacts all aspects of their life. And it's really about providing a space where patients can be heard, be able to tell their story. You know, when I meet with patients, they're not only dealing with the fact that they had cancer, but also the impact that cancer and treatment may even still be having on their life because of those late and those long-term effects that we so often see. It's also not uncommon when I speak with patients, they might be experiencing some anxiety, some depression, some fears, worries, fear of cancer recurrence, which we'll be talking about in a couple of sessions from now, all of those things wrapped up into one. So again, it's providing an opportunity for them to be heard and listening to their story. Next slide, please. So this really briefly are just some possible social work interventions that I utilize when I'm meeting with patients. And, you know, just those cognitive behavioral interventions, cognitive restructuring, teaching them about the connections between thoughts, feelings, and behaviors, discussing what is and what isn't in their control, discussing journal writing, healthy lifestyle behaviors, of course. All of those things can contribute to our overall emotional well-being. Something that I'm certified in is, it's called meaning-centered psychotherapy, and it's really about providing a space for patients to explore what brings meaning and purpose to their life, in addressing some of those existential issues that can come up for cancer survivors. I might suggest to patients, meditation or learning mindfulness practices, as well as sleep hygiene. Another thing that I will also talk to patients about are referrals to mental health providers within the community or psychiatry or even support groups. So thank you. Next, Jevin.
Thanks so much, Angela. And Maura is not with us today, our registered dietitian, but Scott, being her official work husband, can talk a little bit about some of what she would talk about here. Scott, I'm going to turn it over back to you.
Yes, thank you. So, so quickly, I think one of the things that our dietitians do very well is to kind of weed through all of the misinformation, the nutritional misinformation that's out there. So often, our patients may consult Dr. Google as far as what they should be eating moving forward with after their cancer diagnosis. And so it's so critical that our dietitians are able to sit down and be able to spend the time to find out what kind of supplements these people are taking and be able to kind of weed through all of that. And really, the other thing that I think our dietitians really focus on is to say that, our bodies are designed to gain weight easily and to lose weight very reluctantly. So to acknowledge that it is hard to lose weight, especially if you're on long-term hormone therapy or something like that. But you don't need to have a huge weight loss in order to gain any kind of health benefits moving forward. So again, kind of reframing that, I think, is so important. And that's what our dietitians do very well.
Thanks, Scott. I think Maura would be very proud. And lastly, I wanted to touch on my component of the puzzle here, piece of the puzzle. In my part of the visit, talking with people in Survivorship Clinic, we focus on the survivorship care plan and delivering that, and that's a conversation. It can focus around their diagnosis, the treatment they received, and follow-up recommendations. And you'd be surprised how many people have questions about that, or maybe not so surprised, I should say, I guess. We've had people come in the clinic thinking they have stage 4 metastatic disease, when in reality they have stage 1 breast cancer, for example. And so it's really important to reinforce expectations, review the information with them, and it can be a lot of positive benefit for survivors coming through. But in addition to that, we'll talk about advice regarding late effects with regards to the treatment they've had. And we'll also place referrals for people should they need additional help beyond just our services. So really that's the highlight of my part of the visit with our survivors. And lastly, as we're wrapping up here, I wanted to touch on the teachable moment and comment on how important this is, and to take advantage of this with all cancer survivors. And really, survivors find themselves at this malleable point in their lives where they just had this scary diagnosis given to them. They went through all this treatment, and now oftentimes they want to focus on improving their health overall. And that's the teachable moment to capitalize on, because this is the time where they are most malleable, and you can take advantage of that to give them the tools and resources to empower them to make these positive lifestyle changes, not only helping to reduce their risk of recurrence for many potential cancers. As we know, there are a number of modifiable risk factors to do that, but also improve their overall health and well-being and quality of life. And this is something that isn't always addressed. These things that are teachable and we can provide as resources, these are not things that are always addressed in every visit. So that's why we as survivorship providers exist for cancer survivors, to address these needs and really take advantage of this teachable moment with them, to empower them to live the best life they can moving forward. And I wanted to leave everyone with some food for thought. These are some questions I can have up on the screen. I can certainly pull these back up in a moment. How do you discuss survivorship issues in your clinic? what's missing from our current approaches that could be added for all survivors, and how do you address continuity between the oncologist and primary care providers as well. I'm going to get back to this, but I wanted to get to this absolutely. Scott, thank you for this great idea here too. I just wanted to say to everyone, May the 4th be with you. And today being May 4th, I don't know if we have other Star Wars fans in here too, and this is just a quick highlight of what's to come as well. So I'm going to stop the share here so I can see all of your beautiful faces one more time. And I feel like we've talked a lot, and I think we've had a lot of great comments here in the chat as well. So I want to open up the floor, and if anyone wants to go ahead and unmute or put something else in the chat, we can certainly discuss some of what's going on here, but maybe thinking about some of those discussion points that we brought up before, and any thoughts on your survivorship programs or experiences that you've had.
I'll start.
Oh, sorry.
Sorry, Michelle.
Go ahead, Michelle. I see you going here.
Okay, I guess my quick question, I see that when we talk about lifestyle changes, wellness, and even addressing patients who come who have a lot of treatment-related effects, that it's really a process. There's just there are some patients, there's no way that you can accomplish that in a visit. So this idea of a longitudinal clinic or place where, patients will need to know as they're making lifestyle changes that they're accountable to someone and having that follow-up. So I'm just curious, because we talked about that initial visit, do you have that option for this longitudinal visits also over time?
Michelle, yes, and thank you for that comment. I think the next session is sort of the nuts and bolts and some of the logistics of what we do, how we do it, how we're funded. And, to your point, how do we maintain contact with patients? And we'll go over all of that. We do offer follow-up visits. Not everyone takes advantage of that. I wanted to let Tessa give her comment if you'd like to unmute, and I saw you put something in the chat too.
I think the biggest thing, I am a internist and pediatrician from the community in Roswell, brought me here to help. I still hear from my colleagues is they don't know who's supposed to be doing what, who's following what. There's an assumption like with the surveillance of cancers, they assume that the oncologist is doing it, but let's say that the cancer survivor also meets criteria for lung cancer screening, and they assume the oncologist is also doing that screening, but the oncologist is assuming the primary care doctor is. And so how do we bridge that? How do we fix that? As both of you all are smiling and nodding your head. That's one of the biggest things is I would do it if I knew I was supposed to do it, right? So if a cancer survivor has treatments, their guidelines for cancer screening may vary from the general population. So how do we provide education to our colleagues, or do they even have the bandwidth to do it, and should we be doing it? Thanks.
Yeah. Those are amazing questions and comments. I see some people nodding. I know there's many more people in the audience who probably identify with what you're saying, Tessa. I don't know, Jill, as a friend and colleague, if you wanted to comment as well, but I'll tell you, I do a long-term clinic where it's patients who aren't on active treatment anymore in breast cancer, and I often will order their lung cancer screening because it's never been done and it's easy, but I don't order their colonoscopy because that's not as easy for me to order. So it's that's just in all transparency. I agree, and as an oncologist, we need to partner better with our PCPs, make sure nothing's dropped. Then Jill, I don't know if you had a comment to what she said.
I always feel like I own all of it, but that just may be my style of practice. And I do share, a few patients with Tara have certainly been to the Cancer Survivorship Clinic and really appreciate that experience. And I feel like there are things I don't do well, like the nutrition piece, I certainly don't do as well. And people bring me things that I'm sure everyone has this experience of, this new supplement that they got from, that Dr. Oz recommended. And I don't even know if it might be contraindicated with their cancer, never mind what the, chemical composition is. So but I do feel like that is, you know, epic communication helps with that. But I do feel like if we created some sort of cancer survivorship template that gave us some guidelines that we could share back and forth, that would be like such a huge benefit to everyone. Just kind of like how we have a health maintenance basket that we kind of look through and discuss. You know, certainly guided based on people's risks, but in an era of technology, we should be able to do this in a very collaborative way and be able to all see it at the same time.
Thank you, Jill. Other comments, questions? Yes, I see Mary in the chat about the Sloan Kettering database. Yeah, did you want to comment on that?
Yeah, Jill, it's really helpful to have it on your phone so that when people run that by me, yeah, you got it. I don't know, it's life-saving.
Yeah.
And then you sort of sound like you know what you're talking about.
We'll get into some of that here. So over the next 6 sessions, we have topics, and I don't know, Jevin, if you have a summary slide for everything, but we'll email it out. We're also going to do a new session on cancer and cognition. So for those of you doing that work, we'll love to hear from you, and we're going to bring in someone who's doing that work here to be our local representative.
Yeah, so with after each session, you guys are going to get another email with a summary of what's to come, and you know, be reminded that the next one will be nuts and bolts. After that, fatigue, fear of cancer recurrence, energy balance, which will be nutrition and weight management and physical activity, and then cancer and cognition, like Tara was saying as well. So we're going to be touching on a lot as we go through all the sessions here, for sure.
We're a big group, so we won't do the big group introductions because it takes so long. But we just come if it's fun for you. I hope you're getting something out of this. Our goal with this group is to have more discussion time. Certainly you can watch webinars and we can share slides, but we want to keep our didactic short so that we can talk about cases or questions that come up. So just in all transparency, that's what we're hoping for here. And so bring enthusiasm and curiosity and anything that you find interesting that you're seeing in your own patients. You know, this is meant to just, again, build the community that we all really are looking for. So maybe with that, Jevin will sign off for today and say, see you next week, right?
Yeah, I think, you know, it's always good to get back a few minutes here, and that's what I was just going to say, Tara. I think that's perfect. So, you know, we can certainly see each other next week, same bat time, same bat channel, as I like to say. But just to put up here, again, next week, Wednesday, May 11th, same time, noon Eastern time, we'll talk about survivorship, nuts and bolts. Again, as Tara highlighted, feel free to bring your experiences, bring any cases that you have. It doesn't have to be formal. We can just talk about it. And I'm thankful that everyone who was able to talk today was willing to share. I'm going to send out the slides in advance as well, so you have those and can come ready with questions. And then in the follow-up email from today, there's going to be another post-session survey. We do each of these, one of those each time after one of these sessions, so we know what we can be doing better, how to improve even as we go along throughout the sessions, and then overall as the entire clinic. So we want to hear from all of you, and we're excited to learn from you as much as you are from all of us here. So thanks everyone for joining us, and we hope to see continued participation moving forward.
Thank you.
Thank you.
Bye.
Thank you. Take care. See you next week.
Thank you.
Bye.